Here's what's huge. Ryan and I are working on probably the most significant editorial section in JEMS, I think, in the history of the magazine. There are more people that die from septic shock than from cardiac and cardiac arrest combined. You read in the paper about Mrs. Smith went into the hospital, or so-and-so, Danny Thomas, dies from pneumonia. He didn't die just from pneumonia. He died from septic shock. He gets old, he gets an infection, nobody takes care of the infection, he stays at home, nobody picks up on his fever, his increased pulse rate, and his increased lactate levels. Well, how do you tell lactate in the field? You buy a $3,000 device? A $1,200 device? No, one of our editorial board members, two of them actually, well, one is an editorial board member and the other is in Orlando Regional Medical Center, came out with algorithmic medicine that says if he has a rapid pulse rate, if he has the second SIRS predictor of temperature, and he blows a 24 or less on capnography, that capnography reading translates over with temperature and rate and respiratory to this level of lactate. So lactate level now will be announced. This is going to be a septic alert. And where this is huge is if the hospitals begin, they won't do it immediately, but if the hospitals are forced by pre-hospital EMS to pay attention to him, because I think that he, at 95 years old, you don't look 95, but at 95 years old, that he has an infection, they're going to have to pay attention to that, because now I've called on the radio and said that he had a septic alert. What happens is we take a patient to the hospital, they let them lay in the emergency department for 2 hours till somebody finally sees them. That fever keeps on, the septic shock keeps growing. They go up to the ICU and they die of infectious septic shock. We are going to stop septic shock from the field with capnography. Most of the screening tools have relied on a suspicion of infection, greater than 2 of those SIRS criteria. I'm not going to go over a lot of it, but it's not rocket science, folks. A fever of 100.4. Who do you think's carrying thermometers now? Go to your local ambulance and ask to see their thermometer. They threw them out. They're not carrying them. Some of the monitors have a thermometer function. They're going to buy those, folks, because they're going to have to, because temperature of a patient is going to become very important. And if they have 2 of those simple little parameters and an end-tidal CO2 measurement of less than 25, it's correlated with a lactate level of greater than 4, and that shows increased mortality. This is simple stuff. But in 40 pages in the magazine, we're going to show them that in England they're doing this, in Florida they're doing this, in Wake County, help me out, Ryan, Austin, Texas, in a lot of different places. I'm going to do a chart like I've done for the Eagles that are showing what parameters they're using, what's working, and what their success rate. In Orlando, Florida, if you're seen by a medic unit there and your mother has a suspected septic shock, they have a 90% reliability of saying that she should have a septic alert. That is massive, that is huge. And so we're doing a lot of work on that, and you'll hear a lot more about it.